In this lesson, we will review how to perform the Return to Duty or RTD screening. By the end of this video, you will be able to conduct the Return to Duty screening with a service member. The purpose of the Return to Duty screening is to objectively measure whether a service member is ready for return to full duty. The screening is used in conjunction with the patient's subjective history of tolerated physical and cognitive activities to assess readiness. Providers should also consider service-specific return to duty requirements, such as flight, dive, or jump status prior to returning a service member to full duty. The return to duty screening is administered only after a service member has spent at least 24 hours in stage 5 of the PRA protocol with no new or worsening symptoms. Service members are required to pass both the physical and cognitive parts of the RTD screening prior to returning to full duty. The physical RTD screening may be performed in the office, gym, or PT area. Have the service member perform 2 minutes of supervised aerobic activities at an exertion rate of 16 or greater on the Borg Rate of Perceived Exertion Scale. The Borg RPE scale helps estimate how hard someone is exercising. You can estimate the service member's actual heart rate by multiplying the RPE number by 10. It may take several minutes before a service member reports a 16 on the Borg RPE. Recommended activities for the physical screening include exercises that stress the vestibular system, such as modified burpees, sit-ups, or jumping jacks. Other activities may include high knees, step-ups, push-ups, running, using an elliptical, or riding an exercise bike. The provider may also consider simulating a combat environment or integrating occupation or service-specific tasks into the physical screening if possible. Observe the service member for overt symptom provocation during aerobic exercise. If the service member reports or if you notice worsening symptoms, stop the test and have the service member remain in stage 5. Schedule a retest in 48 to 72 hours as appropriate. If the service member completes the physical RTD screening without experiencing any new or worsening symptoms, proceed to the cognitive RTD screening. The preferred neurocognitive assessment method is the Automated Neuropsychological Assessment Metrics, also known as the ANAM. Recent literature supports the use of neurocognitive screening in addition to physical screening. A study of 508 Naval Academy midshipmen found that basing return to duty on resolution of physical symptoms alone would have resulted in 25.1% of the study participants returning to duty before full neurocognitive recovery. Ordering the ANAM is simple, and it is available at most MTFs. Follow the on-screen instructions or see Appendix D of the PRA clinical recommendation for guidance on how to obtain and interpret the ANAM. The ANAM Help Desk is available 24/7 for assistance. If the ANAM is not available, or if you are located in an austere environment, see the full PRA CR for alternative cognitive screening options. If the service member does not pass the cognitive RTD screening, they should remain in stage 5, and the ANAM should be repeated in 48 to 72 hours as appropriate. When the service member has passed both the physical and cognitive RTD screenings, they may be cleared for full duty. In this video, we reviewed how to conduct the return to duty screening, which is required before the service member could advance to the final stage of the PRA. Most service members will return to full duty after about 15 days. However, in some cases, service members may take longer to recover, or they may not pass the RTD screening. In the next video, we will review the symptom-guided management and specialty referral guidance tables that can be used to help manage concussion care in these situations.